Hi there, it's Justin Lubino again with Senior Advisors, and we have a guide that shows the top 5 mistakes people make on Medicare. And for today's video, I just wanted to focus on the number one biggest mistake we see people make on Medicare. And specifically, I had 4 cases in 1 week, last week, 4 individual situations related to this biggest mistake. And the way we categorize it as the biggest mistake, it's from a volume perspective with regards to the number of people we see that make the mistake, but it's also the impact that it has on people when you make the mistake. So what is the number one biggest mistake on Medicare? It's people not enrolling in Part B of Medicare when you're supposed to enroll. So what does that mean? Well, for the majority of people, they fall into this initial enrollment period is when they're supposed to enroll for their Part B of Medicare. It's a 7-month window that's built around your 65th birthday. So it includes the month in which you turn 65. It includes the 3 months before you turn 65 and the 3 months after you turn 65. So this is your 7-month initial enrollment period. Now, your eligibility for Medicare Part B would start on the first of the month in which you turn 65. But again, you've got 7 months that you can enroll, so you can technically enroll 3 months before that, but the eligibility date, the effective date, will be the first of the month in which you turn 65. If you do not enroll when you're supposed to in this 7-month period, there's a penalty. It's 10% per year on your Part B premiums, per year for each year that you're not enrolled in Part B when you're supposed to. So for example, if you wait 3 years and you go to sign up for your Part B, you will be penalized 30% on your Part B premiums for the rest of your life. It's not just 1 month or 1 year. You pay that penalty for the rest of your life. So there's just a little example here at the bottom of this slide. If your birthday falls on September 10th, your eligibility date would be September 1st, but you could sign up as early as June 1st for your Part B in this situation. You could also sign up as late as December 31st, but we do recommend signing up before your effective date. There's also one nuance to this rule. If your birthday happens to be the first of the month, you are eligible for the month prior. So if your birthday was September 1st, your eligibility would be August 1st. No real logic to that, but that's the rule. So you get an extra month if you were born on the first of the month. So what about other people that are still working, for example? And how does Medicare work with those group benefits or group health insurance plans that you may have? Well, these are very important scenarios that you need to be aware of, and after this I'll show you the 4 examples of individuals that I spoke with, again, just last week. The first 2 examples here are for people that are continuing to work after the age of 65, or their wife is still working and you're over the, or your spouse is still working and you're over the age of 65. If the company has less than 20 employees, then Medicare is the primary insurance. Medicare pays first. So you need to get your Part B of Medicare if you're on a group plan that's less than 20 employees. This is very important. If you do not have Medicare, the group plan does not have to pay for your claims. It's a secondary insurance. Medicare is primary in these cases. If it's a larger employer, more than 20 employees, and you're over age 65, and in this case, the group health plan is primary. So you do not need to get your Part B of Medicare if you're working past the age of 65 for a larger company. Or if you're over age 65 and your wife or husband is continuing to work for a larger company and you're covered on their plan, you can continue to do that because the group health plan is primary in that case. Next examples 3 and 4 related to Social Security disability, and it's the exact same rule as the first 2, except it looks at a larger group size of 100 employees. If it's less than 100, then Medicare is primary. More than 100, then the group health plan is primary insurance. The last two, if you're on a retirement plan, Medicare is primary. So you can use your retirement plan as your secondary, but you still need your Part B of Medicare because that's the primary insurance. Same goes for COBRA. This is a big one. You'll see the examples on the next slide. Medicare is primary. If you're Medicare eligible and you're on COBRA, you need to have your Part B of Medicare because it's primary. You can use COBRA as a secondary, although it probably doesn't make sense because it's very expensive, but you need to have Medicare Part B if you're on COBRA. So here are the 4 examples. This was in 1 week. This is why this is the #1 biggest mistake we see. And again, the names here are changed for confidential purposes, but I just wanted to walk through these so you have an idea. This is a very real problem, and we want to make sure that you avoid it or your friends avoid it if you know folks that are of this age. The first one is a 66-year-old woman. This is the most pretty basic scenario. For some reason, she didn't sign up for her Part B during that 7-month initial enrollment period. So what's the impact to her? She can't sign up until the general enrollment period, which is January 1st through March 31st. Fortunately for her, she realized this while she was in the enrollment period. If she had waited until April and then realized that she wanted to sign up, she would have had to wait until January 1st of 2017 to sign up. So that's when she can sign up, but the effective date won't be until July 1st because she missed her initial enrollment period. This is what happens when you sign up during this general enrollment period between January 1st and March 31st. So her Part B won't be effective until July 1st of this year. In addition, she's going to have a penalty for the rest of her life, a 10% penalty on her Part B premiums. Fortunately, it was only 1 year that she didn't have the Part B when she was supposed to. If she had waited a couple of years, this would be even a higher penalty that she'd have to pay on her Part B premiums. So Susie, good thing she caught it, after just 1 year, but it's still going to be a risk to her not having medical insurance up until July. Even if and one other point here, even if she wanted to buy a medical insurance policy, it's illegal. She can't. An insurance company can't sell to someone who's Medicare eligible an individual plan. She can't go on the Obamacare exchange. She can't go out there and buy a plan. So from now until July, she's going to have no medical coverage. She'll have Part A of Medicare, which is for hospitalization, but no outpatient, no doctor's coverage, no surgery. Big impact to Susie. The next example is John and Mary, who is currently on COBRA. So they left the employer, and they did get their Part B of Medicare, which was good. This was very important. But they're overpaying right now for their secondary coverage. So we're looking at setting them up with a supplement and a prescription plan that's going to save them probably about $3,000 or $4,000 for the year on their premiums, rather than paying for that COBRA as their secondary. So they're not that bad off, other than they're paying a lot for that COBRA coverage. The next example is Angela, who has COBRA with no Part B of Medicare. If you remember on the prior slide, Medicare is primary when you have COBRA. So this is a major issue. If she has a significant claim, the COBRA carrier does not have to pay for that claim because it's not primary coverage. Medicare is primary. After Medicare pays, then the COBRA provider should pay for the claim. The good news, and she just caught this in time, she's 7 months into what's called the special enrollment window. You have an 8-month special enrollment window that starts when you go on COBRA, and her 8 months was going to expire at the end of February. So we caught this just in time. She got down to Social Security, and she is going to get a March 1st effective date for her Part B of Medicare. And we're in the process of setting her up with a supplement and a prescription plan as well to replace the COBRA coverage that she has. Again, going to save her a lot of money compared to the COBRA costs. The last example, this is an individual, Michelle, who's currently still working, and she's age 67. She's on her group plan. So a lot of people think, well, if I'm on the group plan, I don't need to go get my Medicare. In a lot of cases, that's true. But if you remember on the prior slide, if the employer is smaller than or less than 20 employees, then Medicare is primary. So Michelle needs to go get her Medicare Part B, and she can use the group plan as a secondary if she wants to, which we're probably going to switch that out for a supplement and a prescription drug plan, again, because it's going to be a more cost-effective solution. But she needs to go get her Medicare Part B because that is primary coverage, not the group plan. So in summary, again, the number one biggest mistake we see is people not enrolling in Part B of Medicare when they're supposed to enroll. There's penalties. There's specific times that you're forced to enroll. If you miss your initial window, the effective date gets pushed out in some cases to July 1st, regardless of what time of the year you're in. This is something that's very significant. We hope you can avoid this mistake when you go to sign up for your Medicare. And if you have any other questions, you can give us a call at the number below, and or you can reach us on our website, www.senior-advisors.com. All right. Hope you have a great day. Thanks.